So you have an interesting event coming up, and people need to know that you're with Everett Bone and Joint right here in town on Pacific Avenue. You've been there for years.
Yep.
And several years ago, you and your organization started what they call an ambulatory surgery center, or you also known as an ancillary surgical center.
Right.
So tell us what that is, I mean, in terminology.
Yeah, well, it is a surgery center. We do surgery there. We're fully equipped to have patients come in and have procedures that are what we call outpatient surgery. So they're surgeries that don't require an overnight hospitalization, and patients can go home to their own home and recover comfortably from the surgeries.
So basically, patients, I mean, let's say they're scheduled for an 8 o'clock surgery, outpatient surgery. They roll up.
They come in at 7 o'clock to give them time to check in and register and get ready and change their clothes. And then they have their surgery at 8 o'clock, and then there's a recovery room there where they recover from their surgery and from their anesthesia, and then we make sure they're comfortable, and then they go home. We require that they have a ride home. We don't let them drive their car home because the procedures involve anesthesia, so they get some happy juice to make them feel better, or a regional anesthetic or some kind of block. So what we're working on, their arm or their leg or their knee or their wrist is temporarily numbed up so they don't have any pain. And the advantage to the patient is that all we do in that surgery center is orthopedic stuff, bone and joint procedures. So the nurses and the anesthesiologist and the people involved in the patient care get really good at what they do.
Mm-hmm.
Unlike a hospital setting where, in the hospital they have to do all these different procedures, procedures on the intestines, procedures on the heart, procedures on the musculoskeletal system. And so they don't get quite as efficient and refined, and a surgery center, a single special surgery center, especially a surgery center like ours, they get really good at, just doing those things.
Are there more of these types of surgeries going on now with the way technology is in surgery?
Yeah, that's part of it. There are more. And it also affords a little bit more efficiencies, and the costs are less for the same procedure. We don't have the big overhead costs that the hospitals have. We're smaller scale, and we can control our costs a little bit better than the hospital can in many ways. And so the product is high quality and for a good price. And so we think that it really offers a good thing in the marketplace for both patients and insurance companies to have procedures in independent surgery centers.
Well, and the advantage, like you said, to the patient is, I mean, obviously it's pretty quick and easy because you're right there in your parking lot, so you're not going down to a big metropolitan area to have surgery.
Right.
They're in and out relatively.
Just to be clear, we don't do the surgery in the parking lot.
Right. Well, yeah. I thought
surgery center.
I thought that's what ambulatory meant. I thought you just walked. That was a walkthrough thing.
I think that comes
like
nice
I thought you got a double latte and a knee scope.
Comes with a beer and a brat too, doesn't it?
Exactly. Yeah. So I mean, but it's quick and easy. I mean, and the other thing is the patient is at home in their bed that night.
Right, and that's the idea. And the idea is also to try to create a more patient-friendly environment than a hospital environment, which can be intimidating and more directed to providing acute care or care for complex or complicated problems. And it's safe. I mean, our surgery center has gone through an accreditation process by the same people that accredit and review the hospital. It's called JACO, and they came in and looked all over our books and spent.
They're pretty
days
thorough.
With us.
JACO is really thorough.
It's really scary thorough.
Yeah, exactly. I know.
We're very proud that we were the first outpatient surgery center in Snohomish County to get JACO certified.
Oh, I didn't know that. Well, congratulations.
Yeah, thanks. I'm really proud of my staff. I mean, the people that run my surgery center, Chris Hayes has been running surgery centers, helped run the operating room at Providence Hospital for years, and just really experienced, great people. The nurses, we sort of cherry-picked from working with them previously, and really well-trained people that, you feel confident in.
Yeah, and you have a little bit of an event coming up here, August 11th.
We do, yeah.
Why don't you talk about that?
Well, part of as an organization, we're trying to make the public more aware of this option of outpatient ambulatory surgery centers as a good option for your care and your surgery if you have your cataracts fixed or your knee scoped or your hernia repaired, it's a good place to go. And so the organization, the National Surgery Center organizations, have organized a national open house and kind of celebrate and let the public know. And that's August 11th, so a week from this coming Thursday. And we're going to have an open house at our place at Everett Bone and Joint Surgery Center from 4 to 11. Some of our friends like Integrated Rehab are helping us, and they're going to be there with some patient information. Wicked Cellars is going to be there with a wine bar. We're going to have the arthroscope out and
that's
a
what
model.
they use for
anesthesia.
Oh, that's awesome.
Yeah. And we're going to have models, teaching models for knees and shoulders with the scope set up, so people can kind of feel what this and look what the scope is and see it on the TV screen. And you
gotta have an Xbox going, because that's kind of dexterity type stuff there. So
no, but they're gonna have the game operation.
Yeah, exactly. Yeah, exactly.
So
The
public is welcome. We love to have people come, and our friends and neighbors, and see our surgery center and see what a great place it is.
Now, there are certain surgeries that you still have to do in the hospital.
Absolutely,
there are some bigger procedures, back surgeries and total joint
total joint replacements. Although the envelope is being pushed more and more for this outpatient surgery. One, for patient comfort's sake, to be, if you're healthy, to be in your own home to recover. Two, in a way, for safety's sake. There are things that can happen in the hospitals and big institutions that you can avoid in a smaller scale operation. And three, because of the technologies, like you mentioned earlier, the arthroscope, we can do things less invasively, so we can accomplish the goals of fixing joints, even some joint replacement, like I said, and some spine surgery is now being done in an outpatient fashion very safely, and people can go home and not have to stay in the hospital.
And interesting, this all kind of came about. You've been at this outpatient surgery for about 10 years, has it been?
11 years.
11 years,
February 13th, I think, we opened in 2000.